Lee, and I am a member of AFSCME3299, and I'm also a shuttle driver here in service for the last 16 years.
And this is an unfair labor practice strike. What does that exactly mean?
It means that UC has broken the law. We're calling them serial lawbreakers in the sense that this particular time they're using intimidation tactics and interference.
What does that mean?
That means, so the interference is during our last strike in November, management and HR got involved, and they told us things like, in particular in my department, that one of the managers said, "Oh, if you're a new worker, you can't strike." That's a lie. That's our union. That's a union protected activity, and that wasn't just in my department. We got complaints from across the departments across the state. So that's where the interference is. And now that we're telling the truth, now that the members are telling the truth about the obscene wage disparities and raises and really making that public, now they're interfering with our right to strike. They're interfering with our ability to post things and tell the truth, to post things in places that we've typically always posted, in places that organizers and members have been able to go and talk to members. They're restricting that now. So those are the most recent unfair labor practices. Prior to that, in November, it was about illegally raising our health care without bargaining. That was an unfair labor practice. They weren't supposed to do that until they bargained, and they haven't been bargaining in good faith.
So is this union busting?
Yes, definitely it's attempted at union busting.
Well, what do the regents and the Governor Newsom say about this? Because the regents are in charge of management, and Governor Newsom appoints all the regents. He's on the board of the regents.
Right. Well, I don't know specifically what they're saying, but I do know that the bargaining team, who is underneath those regents and the governor, the bargaining team is telling us that we don't have the authority to do this X, Y, and Z, that we are offering you that it's fair what we're offering you. And that's what they're saying. They keep saying the same thing. We're offering something, they're just not taking it, right? So that's really all I know.
I mean, a lot of these regents are millionaires.
Yeah,
they're corporate people. I mean, you have a problem with that?
Do I have a problem with that? Yeah, because they're out of touch. They're completely out of touch with the average worker. They don't know what it's like to, have to bike. Well, I bike to work because I love biking to work. I'm lucky enough to be 20 minutes away on a bike, right? But many of my coworkers come from 2 hours across the bridge, right? And then they have to pay exorbitant amounts of parking, right? And they're already traveling. So the regents don't get that. They have people dropping them off in limousines. They have free parking. They get free housing. So they're totally out of touch with our daily struggle as workers.
And the money that UC is making, I mean, apparently this is a profitable business, UCSF Medical Center. What do you think about this idea of what's happening in healthcare and the profiteering that's going on?
Well, it's disgusting to me. This is a public university, right? It belongs to the people. So for them to make it into a business that's all about profit, it's ridiculous. It's obscene.
And how many workers are on strike here?
I'm not sure how many have showed up during this strike or the last couple of days. Altogether, I won't have those numbers till after the strike, but I do know that AFSCME has approximately 37,000 members statewide, from San Francisco all the way down to San Diego. And in San Francisco, we have approximately 6,000 members.
And it seems like also the federal government is attacking public workers, Project 2025. Are you concerned about the attack on NIH and the whole attack on public education and public services by the federal government?
Oh, absolutely. Absolutely, I'm concerned about it. The research and things that we do here at the university, of course it's going to affect that, the funding, right? UC, it's going to cause a problem for UC in that UC is expanding and eating up new hospitals, like absorbing new hospitals. So
is that part of the business model?
Yes, it is, but how are they going to make, with the cuts from the federal government, how are they going to make that run? right? Without us, and then without being able to actually recruit and retain workers because the wage is not high enough. There's an affordability crisis about housing, right? And just basic needs. So people would rather stay in Antioch or in Vallejo and find a job because when you average it out, coming across the bridge, paying toll, parking, everything else, you might as well stay there and get the same wage.
And I understand also that they raised your health care cost. You pay for health care, you work at UCSF Hospital, and you're paying for health care. What's going on?
UC promotes health care worldwide, right? That's one of their slogans, but yet they're not taking care of their own people. And they illegally raised our health care without bargaining around it, you know? I don't know if you were here during the rally earlier when I spoke about being the working poor. You know, I'm definitely part of the working poor. I work here 40 hours, and I'm just basically treading water. I'm getting tired. I'm afraid of drowning. I'm one emergency away from drowning, right, of not being able to take care of those bills of mine. And so when I went to the hospital recently, had an appointment, my copay went up and my prescription went up. I'm already struggling with groceries, with increased rates in PG&E, all those kinds, and now my medicine's going up too.
Shouldn't it be free?
Oh, absolutely, absolutely. Some university that promotes healthcare worldwide, but yet doesn't take care of its own people who work here. Yeah, that's outrageous and not right.
And what are you going to do? What is the union going to do if management takes a hard line? It seems like their attitude is, we don't care and we don't have to do anything.
What are we going to do? We are going to organize that much harder. We're not going to be silenced with these intimidation tactics. We're going to go out and we're going to speak the truth to our members. We're going to spread out and we're going to keep coming back. We're going to keep jabbing them and injuring them and just keep striking. We're going to keep doing it until we win.
Yeah. Have you faced also issues of privatization? Because I know at Kaiser they outsource their bus service. Are you concerned about that? And is that an issue at UC?
Well, currently we have Article 5 in place, which we won in our last contract, which basically protects our jobs from being contracted out. There's a whole list of things that the UC has to do before they actually make that decision. They have to notify the union, they have to give just cause, and it has to be viable, right? So right now, only because of our union winning the right to not contract out and be protected, am I not too concerned. But I know if UC has the opportunity, they'll definitely take that off the table.
My name is Brian Dean. Yeah, I work for the opiate treatment outpatient clinic for UCSF, but we're stationed at SF General Hospital. And we're here today on strike to protest UC's unfair labor practices. Basically, the pay for the work we do, fair pay across the board for the work we do. Also, there's huge staffing shortages in a lot of departments, which is bringing up issues of overtime, of not having vacation addressed, not so much in my department, but as a general in the whole system. So those are the main issues. We just want to be treated fairly and have the help we need to help the patients, because at the end of the day, it's going to hurt the patients.
And how has your patients been affected, and also how is it affecting university workers? I mean, there hasn't been a significant wage increase for some time, with inflation.
Right. Morale, I mean, I can't speak for the whole network. I can just speak for my department. I mean, we just have too many clients, and it's just hard to get enough care for the patients, and that can be demoralizing. I'm a social worker, so.
And I mean, it seems like UC is operating kind of as a business. UCSF is making millions of dollars, every year, but the workers are having a problem making it.
Yeah, it's a lot of people can't even live in San Francisco to be here close to work, so that drives your expense up. The optics, I don't know all the hard numbers, but the optics of UC buying up seemingly half of San Francisco.
Does that cause some anger? Because it seems like they have money for expansion, but the workers who are working can't make it, and they're not giving them what they need. They're buying hospitals, St. Francis, St. Mary's.
Yeah, you would think that they could kick down a little bit more. That's what it seems like, at least, yeah.
And what do you think about the regents?
What am I doing?
The UC regents, a lot of them are multimillionaires. You have Governor Newsom. Where are they on this?
Yeah, like I said, I don't have the hard numbers with them, but it seems like they're getting perks that could be divvied up a little more equally amongst the people doing the important work.
And unfair labor practice, it seems that they've threatened people, told them to take down. Some other workers have said they take down signs, you can't communicate even with your own members.
That I don't know. I haven't had that experience in my department, but if that's been happening, I wouldn't doubt it.
And also there's the issue of attack on NIH with Trump and Musk, right. Doge, saying they want to get rid of NIH, and that would affect, obviously, the University of California big time. Right. Do you have any thoughts about what's going on nationally? As Project 2025 says that they're against public workers. They want to privatize it. Right. They're against unions of public workers. They want to bust the post office, privatize that. Are you concerned that that's going to affect workers here?
Well, yeah, I think the tend towards privatizing everything is basically a power grab for people to make more money, and and cutting funding to the NIH isn't going to keep anybody healthier or safe. Only people who could afford to absorb that would say that. So that just seems like a power grab to me.
And there's a measles outbreak in Texas now. I mean, in New Mexico. I mean, are you concerned that this country is going to be enveloped with these kind of dangerous diseases because of a shutdown of government agencies?
Yeah, it's a very real possibility, and I think maybe more so than the direct funding is the disinformation that goes along with that. I think that could cause a huge problem with the populace, and that's not helpful.
And the fentanyl crisis is all over the country. People have been addicted to to these drugs. What do you think is the cause of it, and you think, what is the solution? I mean, the mayor, Lori, says he wants to have more police and more budget for the police. You think that that's an appropriate response?
I'm a kid of the 80s, and I was there for the war on drugs the first time, and this all seems like it's repeating itself. Do I have a full solution? No, I do not. But just doing sweeps and locking people up, that's not the answer. I think addressing mental health in a real way is a good step. A lot of people out here with mental health concerns, with a lot of PTSD, struggling for a long time. Those need to be addressed.
And if they aren't addressed, what happens? People end up in prison? Is that the?
Yeah, people end up in prison. The prison pipeline continues. Nothing changes. We'll just repeat the same cycle again and again.
And you have solidarity in your union or your unit? I mean, are people out here? What do they think?
Yeah. We're all in this together. It's been cool to be out here with everybody. It's better than I was telling someone this yesterday. It's a hell of a lot better than just doom scrolling. I feel like we're all in this together, being out here for these events. So it's been good.
My name is Ali.
What kind of work do you do?
I work at security department.
Wages, inflation has gone up a lot.
Cost of living expensive. Everything expensive, we cannot afford living in a bar area. Everything raised, the toll is raised, and we have, you go grocery. It's so expensive, we cannot afford coming to work. If you don't get raised, it's gonna be hard, struggling, paying, living paycheck to paycheck. In order to that, we need a raise.
How long have you worked at the university?
Almost 5 years.
So when's the last time you got a raise?
We got a step, but the step is like 1%, 2%. So it's not fair compared to the lifestyle in my area.
Can you afford to live in San Francisco?
No, unless you have to stay with roommate, like 5-6 people. Otherwise, the rent in San Francisco for $3,000, $4,000. Your paycheck is $5,000. You pay rent $4,000. You pretty much we're a slave. It's just like free labor. You know what I'm saying? So it's not like in order to afford living, you have to live far. Like
it costs money commuting too.
And I have a coworker. They come from Sacramento. They're working $26 an hour, and then they have to commute. They have bridge, toll, gas, and then you get paid. I think everybody, if you do 40 hours, if you work full time, you get paid. Maybe after the tax, everything, you might get $3,500, $3,000, and you have rent $2,000, $1,000. You got gas pay. people living paycheck to paycheck, and people living credit card to max out, waiting next paycheck. So it's better like we can, if the university give us raise, it's gonna be more good. Everybody happy. They'll be happy to come to work.
What's your name?
When we fight, we win! When we fight, we win!
I'm Alan Villanueva.
And we're out here at UCSF Mission Bay campus. What's happening today?
What's happening today is protesting about wages, contracts, labor, how it's being treated. And so this is our second time we did protest, in one last year, late last year, and then this year for 3 days. So hopefully, our voice will be heard and action will be done.
And it's an unfair labor practice strike.
Correct.
What does that mean? Does that mean that the university hasn't been negotiating fairly? Or?
I was told yes. No, yeah, yes, sure. That's why we're here. So I can.
And what are the issues? What are your concerns as a worker here at UCSF?
Workload,
what kind of work do you do?
I work for animal care, yes, and labs, So we need a better and fair treatments and fair distribution of labor. So.
And I mean, is it understaffing? Is there a problem with staffing?
Understaffing, and yes, and then a lot of workloads and bias at work. So
Bias? What kind of bias?
bias, favoritism, promotions, and give it this, and yes, all that stuff. So like everyone else is experiencing. So that's what we're here for.
And the inflation has gone up tremendously for people. How has that affected?
Of course, I'm single, but I have to work 2-3 jobs. So
you're a full-time UC worker.
I'm usually working, and I have other part-time jobs and some odd jobs to make ends meet. So just
There are other members as well in that same situation?
yes, sure.
So what does UC say about it? I mean, the fact that you can't even work one job, you have to work 2 jobs, and you're working at a public university.
Right. That's what we're here for.